Imagine waking up each morning with legs that feel powerful, steady, and ready to take on the day. Picture yourself moving confidently without that nagging fear of stumbling, tripping, or feeling your muscles give way. Today, we're diving into the top 7 vitamins that can transform weak, tired legs into strong, stable pillars of support. Now think about it. What would your life look like without the constant worry of muscle cramps or unexpected falls? With the right nutrients, that vision can become your reality. These essential vitamins and minerals not only boost muscle strength and bone density, but also enhance circulation, helping you move freely and live independently every single day. So whether you love dancing, taking gentle strolls through the park, or simply enjoying the freedom of moving without pain, this video is for you. And before we dive into these powerful vitamins, grab yourself a cup of warm coffee or tea, sit back and get comfortable. Now here's a question for you. What's one thing you wish your legs could do better? Drop a comment below and let us know. And if you're ready to discover the secret to stronger, more resilient legs, make sure to hit that like button, subscribe, and turn on notifications so you never miss out on the latest senior health tips. 1. Vitamin D. Let's face it, as we get older, our bodies don't function the way they used to. Tasks that once felt effortless, like climbing stairs or standing up from a chair, suddenly become more challenging. And one of the most overlooked reasons? Vitamin D deficiency. You see, as we age, our skin loses its ability to efficiently absorb sunlight, making it harder to produce sufficient vitamin D. Add to that the fact that many seniors avoid going outside as much due to mobility issues, fear of falling, or skin concerns. And you've got a recipe for disaster. The result? Muscles that gradually lose strength, legs that feel shaky, and bones that grow weaker by the day. But it's not just about bone health. Studies repeatedly show that low vitamin D levels are directly linked to muscle weakness and an increased risk of falls. A study published in the Journal of Clinical Endocrinology and Metabolism found that older adults with vitamin D deficiency were far more likely to suffer from muscle atrophy, making simple activities like walking, standing, or even maintaining balance significantly harder. Imagine struggling just to stand up from a chair. That's how powerful vitamin D is in maintaining our leg strength. And here's where things get serious. Without enough vitamin D, those quick-reacting muscle fibers, the ones that help you catch your balance when you trip or slip, can't function properly. They lose their ability to respond rapidly, increasing the risk of falls and serious injuries. But it doesn't stop there. Vitamin D also plays a vital role in reducing inflammation in muscle tissues. Think about those nagging leg cramps, that persistent stiffness, or the unexplained aches that just won't go away. Optimizing vitamin D levels can significantly alleviate these symptoms, giving you back the freedom to move without discomfort. Now here's the frightening part. Ignoring a vitamin D deficiency doesn't just weaken your legs, it can set you up for far more severe health complications. Osteoporosis, fragile bones that snap like twigs, and fractures that can take months to heal. And if that wasn't enough, vitamin D deficiency is also associated with impaired immunity, cognitive decline, and even cardiovascular issues. So what's the takeaway here? Getting enough vitamin D isn't just about avoiding bone fractures. It's about maintaining the strength to walk, climb, and move confidently every single day. It's about protecting your independence, your balance, and your ability to live life without constant fear of falling. But how do you ensure you're getting enough vitamin D? Stay tuned. We're going to reveal exactly how you can do that in the next section. 2. Calcium. When it comes to protecting your legs and keeping them strong as you age, calcium is a game changer. You might think it's just about bones, but there's so much more to this essential mineral. Let's break it down. Imagine this. As we age, our bones are no longer the solid, unbreakable structures they once were. They gradually lose density, becoming weaker and more fragile. And where does this show up the most? The legs. From hip fractures to stress fractures in the lower extremities. These injuries can turn a minor fall into months of painful recovery and restricted mobility. But calcium isn't just about bones. It's the spark that fires every muscle contraction. Picture each time you stand up, take a step, or climb stairs. Calcium ions are working behind the scenes, sending signals to your muscles, ensuring they contract smoothly and effectively. Without enough calcium, those signals get weaker, leading to muscle cramps, stiffness, and that all too familiar feeling of your legs being heavy and sluggish. Now here's the tricky part. How do you get enough calcium? Yes, milk, yogurt, and cheese are excellent sources, but they're just the beginning. Sardines, almonds, bok choy, kale, tofu, and fortified plant-based milks are all packed with calcium too. The key is variety. Eating a range of calcium-rich foods not only boosts absorption, but also helps maintain bone density over time. But for some seniors, diet alone might not be enough. That's where calcium supplements come in, especially when paired with vitamin D, which acts like a transport system, ensuring calcium actually gets absorbed into the bones. But there's a catch. Too much calcium can backfire. Oversupplementation can lead to digestive issues, kidney stones, or even calcification in arteries. That's why finding the sweet spot is crucial. For older adults, the recommended daily intake is around 1,000 to 1,200 milligrams of calcium per day, ideally from a mix of foods and supplements. And it's not just about consuming calcium. It's about using it effectively. That means getting up and moving. Walking, resistance training, and even light jogging are weight-bearing exercises that direct calcium to the bones and muscles, strengthening them from the inside out. Remember, no amount of calcium will protect your bones if you're not moving. Sitting all day not only weakens muscles, but also prevents calcium from being deposited where it's needed most, in the bones. So the takeaway here is simple. Calcium isn't just about preventing fractures. It's about protecting your independence, your mobility, and your freedom to move confidently every single day. And in the next section, we'll dive into another nutrient that plays a surprisingly powerful role in maintaining leg strength. Stay tuned. 3. Vitamin B12. When it comes to leg strength, everyone talks about protein and calcium. But what about vitamin B12? This often overlooked nutrient is the powerhouse behind your nervous system. The command center that sends electrical signals down your spinal cord and into your legs, telling them when and how to move. Now imagine this. Your legs feel heavy, weak, and constantly tired. Maybe you're experiencing tingling or numbness that makes every step feel unsteady. What you might not realize is that these are classic signs of a vitamin B12 deficiency. And the shocking truth, it's far more common among older adults than you'd think. Here's why. Unlike other vitamins, B12 isn't easily stored or absorbed by the body. It relies on a specific protein called intrinsic factor, along with sufficient stomach acid to be absorbed properly. And as we age, our ability to produce both declines. Add to that digestive issues like gastritis, acid reflux, or long-term antacid use, and you've got a perfect storm for B12 deficiency. But that's not all. Many seniors already consume diets low in B12-rich foods like meat, seafood, eggs, and dairy. And for those who follow plant-based diets, the challenge is even greater because B12 is virtually absent in plant foods. The result? A slow but steady depletion of this vital nutrient, leading to muscle weakness, balance problems, and even nerve damage. Now think about this. When nerve function is compromised, your legs don't just feel weak. They lose their ability to react quickly, increasing the risk of falls and injuries. This is why B12 is so crucial. It supports the fast, accurate signaling between your brain and muscles, enabling quick reflexes and stable movement. But here's the good news. B12 is one of the safest vitamins to supplement. Since the body naturally excretes excess B12 through urine, even higher doses are generally well tolerated. That's why seniors who struggle with absorption can safely take B12 supplements or receive regular B12 injections to maintain optimal levels. The key sources? Animal products, lean meats, seafood, eggs, dairy, liver, and clams. B12 fortified foods, breakfast cereals, plant-based milks, and nutritional yeast. Supplements, B12 pills or sublingual drops for those with absorption issues. But here's the takeaway. Strong legs don't just depend on muscles and bones. They rely on the nervous system's ability to communicate clearly and quickly with every step you take. And without enough B12, those signals get muddled, weakening your response time and increasing the risk of falls. So before you dismiss those wobbly legs as just another sign of aging, ask yourself, are you getting enough B12? In the next section, we'll explore another nutrient that's just as essential for leg strength and just as overlooked. 4. Magnesium, the silent powerhouse that keeps your legs moving smoothly. You might not think much about it, but imagine this. You're lying in bed, ready to drift off to sleep, when suddenly a sharp cramp shoots through your calf. You stretch, you rub, but the pain keeps coming back. Sound familiar? That's a classic sign of magnesium deficiency. Magnesium is the master regulator of muscle function. Every single step you take, every time you stand up or sit down, magnesium is there, ensuring your muscles contract and relax seamlessly. Without enough of it, your muscles become tense, stiff, and prone to sudden, painful spasms. And for older adults, those cramps aren't just a minor annoyance. They're a clear warning that your body is out of balance. But magnesium's role doesn't stop at muscles. It's also crucial for bone health. While calcium gets all the attention, magnesium is what ensures that calcium actually ends up in your bones and not in your joints. Without enough magnesium, calcium can build up in soft tissues, causing stiffness, pain, and even joint calcification. That's why seniors who get enough magnesium often have stronger bones and a lower risk of fractures. Here's the problem. Magnesium is one of the easiest nutrients to lose. Stress, medications, and poor diet can deplete your magnesium stores rapidly. Blood pressure meds, diuretics, and acid reflux treatments can all flush magnesium out of your system. And when magnesium levels drop, so does your stamina. A short walk feels exhausting. Climbing stairs feels like a workout. Your legs feel heavier, stiffer, and weaker. But there's good news. Magnesium is one of the easiest nutrients to replenish. It's found in everyday foods like black beans, lentils, almonds, pumpkin seeds, spinach, and avocados. But if diet alone isn't enough, supplements are a safe and effective option. Magnesium citrate and magnesium glycinate are particularly well absorbed and can quickly restore depleted levels. So what happens when your magnesium levels are back on track? Those nagging cramps become a thing of the past. Your muscles feel more relaxed, your legs feel lighter, and even your sleep improves as your body finally gets the chance to unwind. And those late-night spasms? Gone? Bottom line? Magnesium isn't just another nutrient. It's the key to keeping your muscles relaxed, your bones strong, and your legs ready to move without pain. And in the next section, we're diving into another essential nutrient that can make all the difference for your leg health. Stay tuned. 5. Potassium. The nutrient that often gets overlooked but holds the power to keep your legs strong, steady, and cramp-free. Imagine this. You're just waking up in the morning, about to swing your legs out of bed, and suddenly, bang, a sharp, painful cramp seizes your calf muscle. You wince, you stretch, but the pain keeps pulsing through. Sound familiar? That's one of the most common signs of potassium deficiency. Potassium is the key player that maintains the balance of fluids inside and outside of your muscle cells. When potassium levels drop, that balance gets disrupted and your muscles pay the price. Cramps, spasms, and that nagging sense of weakness can all stem from a simple lack of this essential mineral. But the problem goes deeper than that. Think about those times when you've been standing for a while and your legs start to tremble, or when you try to lift your foot and it just doesn't respond the way it should. That's potassium deficiency at work. You see, potassium facilitates the transmission of nerve impulses from your brain to your muscles. When levels are low, those signals get muddled, making it harder for your brain to tell your legs to move smoothly and steadily. The result? Weakness, unsteadiness, and a higher risk of falls. But here's something most people don't realize. Potassium doesn't just protect your muscles, it also supports bone health. Surprised? Potassium helps neutralize acidic compounds in the body that can leach calcium from your bones over time. This means that getting enough potassium can actually reduce your risk of osteoporosis and keep your leg bones stronger for longer. Now you might be thinking, well, I eat bananas, so I'm good, right? Not so fast. Bananas are a great source of potassium, but they're far from the only, or even the best, source. In fact, a baked potato with the skin on packs more potassium than a banana. Other potassium-rich foods include avocados, spinach, beans, oranges, and sweet potatoes. And don't forget about leafy greens like Swiss chard and kale. They're potassium powerhouses too. But what if you're not getting enough potassium from food alone? Supplements can help, but they're not a one-size-fits-all solution. The recommended daily allowance of potassium is 3,400 milligrams for men and 2,600 milligrams for women, but those with kidney issues or high blood pressure need to be cautious. Too much potassium can be just as dangerous as too little, so it's crucial to talk to your doctor before adding supplements to your routine. So what's the bottom line? Potassium is more than just a cramp fighter. It's a lifeline for your muscles, your bones, and your balance. Without it, your legs can't respond quickly, your muscles can't stay strong, and even a simple walk across the room can feel like a struggle. But when you make potassium a daily priority, you're giving your legs the support they need to stay strong, steady, and ready to take on the day. And now let's move on to another nutrient that's just as critical for maintaining strong legs as you age. 6. Vitamin K. Vitamin K might not get the same spotlight as calcium or vitamin D, but without it, those nutrients can end up in all the wrong places. Think of vitamin K as the body's traffic controller, ensuring calcium doesn't settle in arteries or soft tissues, where it can cause stiffness and poor circulation, but instead goes straight to the bones where it's needed most. This is especially crucial for older adults. As we age, our bones naturally lose density, increasing the risk of fractures. But here's the good news. Studies reveal that getting enough vitamin K can significantly reduce that risk. It works by activating osteocalcin, a protein that binds calcium to the bone matrix, making bones stronger and less prone to breaking. But vitamin K isn't just a bone-strengthening nutrient. It also keeps your joints supple and your muscles coordinated. If you're dealing with stiff knees every time you stand up, or feeling like your legs just don't move the way they used to, you're not alone. Many seniors experience these issues, but they don't realize that a lack of vitamin K could be part of the problem. Research shows that vitamin K reduces joint inflammation, particularly in the knees, which can help slow the progression of osteoarthritis. It also regulates calcium within muscle cells, allowing your muscles to contract and relax properly. Without it, your movements can become clumsy and uncoordinated, increasing the risk of falls. So, where do you get this powerhouse nutrient? It comes in two forms. Vitamin K1, which you'll find in leafy greens like spinach, kale, collard greens, and Brussels sprouts. Vitamin K2, which is more potent and stays in the body longer. It's found in fermented foods like natto, aged cheese, liver, and egg yolks. Just one serving of sautéed spinach or a kale salad can boost your vitamin K1 levels, while a small portion of fermented soybeans or a slice of aged cheese can pack a powerful dose of K2. But if you're on blood thinners, be cautious. Vitamin K plays a key role in blood clotting, so talk to your doctor before making any major changes to your diet or considering supplements. Bottom line, if you're serious about keeping your legs strong, your joints flexible, and your bones dense, don't ignore vitamin K. And next, we're diving into our final nutrient, one that might just surprise you. Keep watching. 7. Vitamin B6. The unsung hero when it comes to keeping your legs strong, steady, and pain-free. You might not think much about it, but without this crucial nutrient, even the simplest movements can feel like climbing a mountain. Vitamin B6, also known as pyridoxine, is vital for maintaining muscle strength and nerve health. It's the nutrient that ensures your muscles can effectively use protein to build and repair tissue, preventing muscle atrophy and keeping your legs feeling powerful. Imagine trying to stand up from a chair and feeling like your legs just won't respond. That's what can happen when B6 levels dip too low. But muscle strength isn't the only area where B6 shines. This nutrient is also a key player in nerve communication and coordination. Think of it as the messenger that delivers signals from your brain to your muscles. When B6 levels are low, those signals slow down, leading to symptoms like tingling, numbness, and unsteady movements. Seniors often mistake these signs for natural aging, but in reality, they could be a direct result of B6 deficiency. And there's more. If you're dealing with muscle pain, stiffness, or fatigue after even mild activity, it might not just be old age. Vitamin B6 helps regulate inflammation, reducing muscle soreness, and speeding up recovery after exertion. Those lingering aches and that heavy, sluggish feeling in your legs could be your body's way of saying it needs more B6. But that's not all. B6 is also essential for red blood cell production, ensuring that your muscles get enough oxygen to maintain endurance. When B6 levels are low, your hemoglobin production drops, meaning your muscles aren't getting the oxygen they need. The result? Fatigue sets in fast, making it harder to stay active, walk long distances, or even climb a single flight of stairs. So how can you get more B6? The good news is it's found in plenty of everyday foods. Chicken, fish, especially salmon and tuna, and lean meats, bananas, potatoes, and chickpeas, fortified grains and cereals. For older adults, the recommended daily intake is 1.5 milligrams for women and 1.7 milligrams for men. But those with digestive issues, poor nutrient absorption, or dietary restrictions might need to consider supplements. But be cautious. While B6 is essential, too much can be harmful. Long-term use of high-dose supplements can actually cause nerve damage, so it's best to stick to recommended amounts unless otherwise advised by your doctor. Bottom line, vitamin B6 is your go-to nutrient for strong, resilient legs and stable, coordinated movements. It fuels your muscles, protects your nerves, and helps keep those painful cramps and heavy legs at bay. And with one more crucial nutrient left to cover, we're about to reveal the final piece of the puzzle for maintaining powerful legs well into your golden years. Imagine reaching for all the right vitamins to strengthen your legs, but unknowingly consuming the wrong ones that could silently work against you. Yes, that's right. Some vitamins that seem beneficial can actually be harmful to your leg strength if taken in excess or without caution. Let's talk about the vitamins you should avoid or limit to keep your legs strong and your body moving smoothly. First up is vitamin E. While it's widely known for its antioxidant properties, taking too much can thin the blood, increasing the risk of excessive bleeding. For seniors who are already on blood thinners, this can be especially dangerous. What starts as a simple supplement can quickly turn into a hidden risk factor for bruising and bleeding, weakening your ability to stay active and steady on your feet. Next, let's talk about vitamin A. Yes, it's essential for vision and immune health, but when it comes to your bones and muscles, too much can actually deplete bone density. Excessive vitamin A can interfere with vitamin D absorption, making your bones more brittle and your legs more prone to fractures. That morning multivitamin might seem harmless, but if it's loaded with vitamin A, you could be setting yourself up for unexpected falls and painful injuries. And then there's vitamin K, the blood clotting powerhouse. Normally, it helps direct calcium to your bones, but for seniors on blood-thinning medications like warfarin, too much vitamin K can increase the risk of blood clots, undermining the medication's effectiveness. Imagine thinking you're protecting your bones, only to end up with a clot that could threaten your mobility or even your life. So what's the takeaway here? While vitamins are vital for overall health, more isn't always better. The key is to maintain balance, consult with your doctor before starting any new supplement, and ensure that what you're taking is actually benefiting your muscles, bones, and overall leg strength, not silently weakening them. Now, with this crucial warning out of the way, we're ready to wrap up with a powerful conclusion that ties everything together and gives you the actionable steps you need to take today. Your legs are more than just muscles and bones. They're your gateway to independence, strength, and confidence. And today you've uncovered the 7 essential vitamins that can keep them strong, stable, and ready to carry you through life's every step. But remember, it's not just about what you add to your diet. It's also about what you avoid. Choosing the right vitamins and steering clear of those that can secretly weaken your legs is the key to lasting strength. So now I want to hear from you. What's one thing you're going to do today to protect your legs and keep them strong? Drop a comment below and let us know. And if this video gave you a fresh perspective on senior health, go ahead and give it a thumbs up, subscribe, and hit that notification bell so you never miss our latest tips on living a strong, vibrant life after 60. Stay tuned because in the next video, We're diving into a surprising food that could be sabotaging your leg strength without you even realizing it. You won't want to miss it. Until then, take care, stay strong, and remember, you deserve to live every single day feeling powerful, confident, and ready to take on the world.